I want to thank you for attending this webinar on the TriZetto HIPAA breach update. Just a quick disclaimer before we get going. The information in this webinar is for educational purposes. It's not intended to be a substitute for your clinical decision making. It's not intended to substitute your billing protocols. It's not intended to be legal advice. Target coding does not provide legal services. CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this webinar is 100% accurate. However, it's not guaranteed. We have a lot of people listening to this webinar. Some of you are past attendees of our webinars and seminars. Some of you are members of Target Coding, and some of you are brand new to my company. Some of you have no idea who I am. So let me tell you a little bit about myself before we get going. Again, my name is Dr. Marty Kotler. I'm a chiropractor. I practiced for 16 years prior to starting my company, Target Coding. I'm also a certified professional compliance officer and certified billing and coding specialist. My area of expertise is in billing, coding, cash practice compliance, durable medical equipment, documentation, risk management, record keeping, Medicare, and HIPAA. You know, I consider myself kind of unique. Let me tell you why. Most doctors are not certified coders. Most certified coders are not doctors. So you'll see during this program how I combine both specialties to help you improve productivity, help you prevent problems, reduce administrative burden, show you how to get paid for everything you do. Target Coding has been helping thousands of doctors and their staff members for over 15 years with our exceptional products and services. Target Coding members, you're going to receive a certificate of attendance 24 hours after this program is over. Log into your account and you can download your certificate of attendance. You'll also be able to get the playback recording just in case you don't make it through the entire webinar today. If you fall asleep, you could listen to it again. Target Coding members, you're also going to get the PowerPoints, all the PowerPoint slides I show during this webinar you're going to get, and any forms. You're going to see some HIPAA forms, sample HIPAA forms. So just to recap, Target Coding members, you will receive a certificate of attendance, the playback recording link, all the PowerPoint slides and forms. Just log into your account, give us 24 to 48 hours, log into your account, and all of these items will be waiting for you. And the certificate of attendance is important. Place your certificate of attendance in your billing and coding policy manual, just in case the HIPAA police or the coding police show up at your door. Use their certificate of attendance as proof that you take billing, coding, and HIPAA prevention, breach prevention seriously, and you care about preventing fraud and abuse. Any questions so far? Email info@targetcoding.com, and one of our staff members will get back to you right away. Okay, let's begin the webinar, the TriZetto HIPAA breach update. To begin with, what happened? What happened? Let's go over the background. Back in October of 2025, TriZetto found that there was some suspicious activity in their program. By the way, TriZetto is a clearinghouse. Clearinghouses are companies that submit claims to insurance companies and to other organizations on behalf of providers. So TriZetto found that there was some sort of suspicious activity used on a portal by chiropractors and other healthcare providers. So TriZetto is required to investigate the situation, and they discovered that this unauthorized access was going on for almost a year. It started back in November of 2024. It's a long time for cyber criminals to have access to all of this information. So the unauthorized access involved patient protected health information known as PHI. So this breach exposed sensitive patient information. Cyber criminals may have accessed the patient's names, your patient's names, addresses, dates of birth, social security numbers, health insurance numbers, including Medicare numbers, and your name, and other demographic details. Cyber criminals get access to a lot of information once they break into a patient file. TriZetto has a parent company. It's called Cognizant. So now Cognizant and TriZetto are facing multiple class action lawsuits. Why? Because this has become a burden placed on patients. Patients now have to protect themselves from identity theft. So you may have gotten letters in the past from other companies. I got a letter from my car company. I got a letter from another organization about a breach. So now, as the victim of this breach, you now have to take action. You have to check your Experian and your identity theft websites. You have to make sure that you're not getting any cyber criminal activity. It places a burden on patients. So there are law firms now that are contacting patients to join in a class action lawsuit against TriZetto and Cognizant. So now what are the lawyers trying to do? They're trying to get a settlement and get patients paid for the time and effort to protect themselves from identity theft. So what may now happen is attorneys may need to contact you, the doctor, to confirm that the patient was indeed a patient of yours and they have had their information breached. This can cause a lot of stress on you as the provider. Now you have to expose yourself to attorneys, letting them know that these patients are indeed patients of yours. And you may now have to expose yourself to your HIPAA policy and procedure manuals and policies. So under HIPAA, covered entities, which are you, healthcare providers, clearinghouses, and insurance companies are all covered entities. So covered entities like chiropractors and their business associates, such as TriZetto, are required to report breaches. Providers, now you, if you were notified by TriZetto that you were involved, you have to make a decision to handle this on your own or let TriZetto report on your behalf. Regardless of vendor involvement, you ultimately are responsible for ensuring full compliance. So what happens if you were notified? We're going to go over what happens if you were notified or if you were not notified, what to do. So TriZetto should have notified you if you were affected. They are offering assistance. I recommend you take them up on all issues and let them handle it on your behalf. That's up to you. So TriZetto will offer assistance. They'll send patients notification letters. TriZetto will notify regulators. They will provide you a list of patients that were affected. TriZetto will cover all the costs of credit monitoring and identity theft services. What should you do? You should document the issue in your HIPAA compliance manual if you have one. I would take a guess that at least 50% of you listening to this webinar do not have a HIPAA compliance manual. If you do, document this issue in your HIPAA compliance manual. Include the date, time, and the details of all your phone calls and emails regarding this issue. Again, we recommend that you let TriZetto handle all breach-related issues on your behalf, but that's totally up to you. Now, if you were not notified, you are in luck. Regarding this TriZetto breach, you don't have to take action. However, this is a great time to get proactive and prevent problems from happening in the future. You want to reduce stress. You want to protect your business. So if you were notified, now you know what to do. If you weren't notified, take some action steps. Let me go through some action steps. First, contact all your vendors and business associates that have access to your patient records. By the way, a business associate is a company, a person, an organization that has access to your patient information, but they're not employees, like billing companies, software companies, clearinghouses like TriZetto, There's many other clearinghouses. Availity, you know all of them. Office Ally, I could name a whole bunch of them. Business associates also include IT consultants, collection agencies, transcription services. If you have a business associate, make sure your business associate agreements are current and they provide protection against breaches beyond your control. Like this one, TriZetto had a breach. You had no control over it. So you want to make sure your business associate agreements cover the costs. If there's a breach beyond your control, you don't want to have to pay for the costs to cover yourself regarding this breach, and there are costs involved. Now, you may have cyber criminal insurance. That's a good thing to have. Some malpractice insurance companies include cyber criminal insurance. Vendors and all your business associates also have to abide by HIPAA. If you're using a billing company, ask your billing company, do they have a HIPAA compliance program in place? Do they have a HIPAA compliance officer? Do they do security risk assessments? Security risk assessment. You should be doing a security risk assessment to evaluate your current risk exposure. It's actually a good exercise to do. Make it fun. See how your score measures up. See how you do. By the way, if you see Medicare Part B patients, you must abide by HIPAA. You are involved with government, federal agency, patients, and money. Medicare Part B pays chiropractors for spinal manipulation. 99% of the doctors we work with see Medicare Part B patients. Even my practices that I work with that are all cash, they'll say, Dr. Kotler, we're all cash except Medicare. We accept Medicare. So if you see Medicare Part B patients, which is probably 99% of you listening to this, you must have a HIPAA compliance program, a formal HIPAA compliance program in place with policies and procedures. It's not scary. It's a good thing to do. Chiropractors must protect patient privacy, secure electronic data, follow the rules disclosing PHI. You must adhere to the HIPAA privacy security rules. By the way, there's something called billing and coding compliance. Now, when I hear a doctor or a staff member come up to me after a seminar or a webinar and say, based on what you taught us today, Dr. Kotler, I just want to make sure I'm compliant. I want to make sure I'm doing everything right. So if you want to do everything right, take out a piece of paper, draw a line down the middle. On one side, HIPAA compliance. On the other side of the line, billing and coding compliance. Two different compliance programs, which I strongly recommend you incorporate. Most of you do not have a billing and coding compliance manual. You should. Again, just in case the coding police come knocking on your door, they're going to ask, who's in charge of billing and coding? Do you have regular trainings? Prove to us. Do you have a training log that we could take a look at? So you want to make sure your practice is protected. You want to make sure that you are avoiding problems. Put together a HIPAA compliance program and a billing and coding compliance program. By the way, we could help you with both. You probably knew that already. You don't have to use us. Doesn't matter to target coding, what company you use, but use someone to help you unless you could figure it out on yourself. Now, I'm going to give you a little bit later, I'm going to give you a couple of websites where if you have the time to incorporate this on your own, you may not be able to afford paying someone to do it. It's not that much, but still some of you are on a tight budget. Start putting one together yourself. I'll show you how to do that a little bit later. So, by the way, HIPAA, That stands for the Health Insurance Portability and Accountability Act. It became a law. It's been around for almost 30 years. Main purpose of HIPAA is to protect patient health information. Very different than billing compliance. The purpose of billing and coding compliance is to prevent billing and coding fraud and abuse. HIPAA has 3 rules: privacy rule, security rule, and breach notification rule. Again, you are all considered covered entities. Covered entities must abide by HIPAA. Covered entities include chiropractors, medical doctors, most healthcare providers, insurance companies, and clearinghouses like TriZetto, like Availity. Let me go over some specific things you should be doing right away. You should have good forms, intake forms, consent to treat minor forms, no surprise law forms. There's many forms that you should have going in your practice. The main form I want to refer to is the HIPAA Notice of Privacy Practices. The HIPAA Notice of Privacy Practices. You probably have one. Is it up to date? You want one from Target Coding? Let us know. Send an email to info@targetcoding.com and we'll send you our Notice of Privacy Practices. It has very important information in it. One part of the form talks about how you're going to share information. That's something you must let patients know. How are you going to be sharing their information? Why is it important to let patients know you're going to be sharing their information, like their names, their addresses, their phone numbers? Yeah, you know why, in order to get paid. Now, a couple of things regarding the HIPAA notice. It has to be done with all new patients. Now, do you have digital forms that patients are filling out? If you have patients logging in to a website and they're filling out your new patient intake paperwork, make sure your notice of privacy practices is in there so they get an opportunity to see it. Some of you are using paper intake forms. So if you have a new patient coming in, filling out new patient paperwork on paper forms, then you must give every patient an opportunity to see your HIPAA notice. Now, you can give everyone an actual copy of the HIPAA notice, or we instruct our clients to laminate one. Have one laminated HIPAA notice, put it in your paperwork with your new patient intake forms so everybody gets an opportunity to see it. Again, you can give everyone a copy. Either way, you have to let them see it, or you can give everyone a copy. You also need to post it somewhere in your waiting room. You could put it in a frame on the wall. Many of the doctors we work with have a television monitor that loops chiropractic messages. Put your HIPAA notice in that. If you have a website, you're supposed to post your HIPAA notice on your website. Now, you also have to have a page that the patient signs. It's called the acknowledgement of HIPAA notice. And it says, we're required to offer you a copy of our HIPAA notice, which states how we're going to use your information. And you may want to add some optional information in it. Example, can we confirm your appointments by email, text, or phone? Some of you have open therapy rooms, or you have a half a wall doctor speaking to patient number 1, but patients 2, 3, and 4 could hear the conversation. It's not a HIPAA violation, but try and keep your conversations at a low level. It's incidental disclosure. Put something like this in your HIPAA notice. We utilize an open therapy room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room if requested. Mrs. Smith, are you comfortable being treated in an open room? Why am I saying all of this? I want to protect you. Many of you listening to this are older than me, but I treat all my clients as if they're my children, and I want to put a armor around you. I want to protect you from anyone that's looking to give you problems. That's what we do at Target Coding. We're all about prevention, avoiding problems. Review all of your forms with our members. We do a scrubbing of forms. I was scrubbing a doctor's HIPAA notice, and I saw a lot of dental information in his HIPAA notice. I contacted the doctor. You know what he said. He told me that his brother-in-law is a dentist. He just took his brother-in-law's HIPAA notice, and that's what he's using for his chiropractic practice. That's not okay. Have you ever had a patient refuse to sign your HIPAA notice? That's unusual. You must treat the patient. If that's the only thing that they are not doing, they don't want to sign your HIPAA notice, you're still supposed to treat them. But I would recommend you fill out a form. Here, you see on the screen, this is a sample form if anybody would like a copy of this form. This is the form that talks about patient refuses to sign our HIPAA notice. What do you do? So more action steps to prevent problems. Let's go through a few of them. Someone needs to be named the HIPAA compliance officer in your practice. The compliance officer is usually an employee whose responsibilities include ensuring that the company complies with federal and state requirements and internal policies. The compliance officer may also designate or update internal policies. Now, doctors, if you don't have a trusted staff member that's willing to take on the role of your HIPAA compliance officer, then name yourself your HIPAA, the HIPAA compliance officer. That's okay. Doctor or a staff member must be given the title of the HIPAA compliance officer. The compliance officer must have an excellent and thorough understanding of the business, have skills and qualities which allow him and her to train and raise awareness amongst company staff. Compliance officers are expected to provide an objective view of company policies and always be on alert for potential areas of risk. What about a security risk assessment or security risk analysis? You should do this. Test yourself. It's an exercise and you'll get a score. Don't you want to know your score? Maybe you're scoring very well. That should make you sleep better at night. Are you scoring an 80, a 90%, 95%? Are you scoring a 60%? Are you failing? So the purpose of a security risk assessment is to identify where PHI is located, any threats. Couple of simple questions. Do you have antivirus software installed? I'm assuming most of you will say yes. Great. You're on your way to scoring 100%. How about another question? Do you have a recovery procedure in place? What happens if there's a flood, a fire, some sort of natural disaster, and it damages your system and you lose patient information? Do you have a backup procedure in place? Hopefully you're all saying yes. Great, you're on your way to scoring very well. Do you train your staff on workstation policies? Are you okay having your staff members check their personal email on a company computer? Have a policy on it. Do you have any staff members that take home information on their laptops where they log in from an iPad or a laptop from home? Have a policy on that. Do you require your staff to change their passwords? Some basic stuff. Let's talk a little bit about business associates. I mentioned it earlier. A business associate is any person or organization that has access to your patient information, but they're not employees. If you have a business associate, and I would say 99% of you have business associates, you might not even realize you have a business associate. I mentioned them earlier. IT consultants, billing companies, clearinghouses, attorneys in certain situations, transcription services. These are all considered business associates. I'm considered a business associate with some of the clients that I work with. I'm working with a doctor that's involved in a post-payment audit. Insurance company wants money back, a lot of money back. This doctor has an attorney, and now the attorney has hired me to do a forensic evaluation of the notes. I am now looking at the patient's names, addresses, their diagnosis. I'm considered a business associate to many doctors across the country. I have a business associate agreement with every doctor where I'm going to see their personal information. So take a look at your business associates. Make sure you have updated business associate agreements. One of the most important parts of a business associate agreement is if there's a breach, who's responsible to pay for the breach expenses? I mentioned that earlier. Have that outlined in your business associate agreement. I have a few more forms I want to share with you. Patient authorization to release information. Yes, if you're in practice for a while, you're going to have some patients that say, I'm moving, doc, I'm moving to another state. I would like to get a copy of all my records. Have them sign a authorization to release information. What about a testimonial? Testimonials are great. You want to post them on your Instagram pages, your Facebook pages, social media. Let everyone know that you're getting patients well. Imagine if you had, I'm going to pick a very well-known person, Taylor Swift, so popular. If Taylor Swift came into your office and said, I am getting numbness and tingling down my arms into my hands and I cannot play the guitar, I cannot continue to tour, and now you treat Taylor Swift after 6, 8, 10 visits, she says, I don't have any more numbness in my arms. I'm able to play the guitar now. I feel so much better. Wouldn't it be nice to get Taylor Swift to give you a video testimonial, a photograph, a selfie with her, a written testimonial? You put that on your social media pages, you would probably have 300 new patients waiting at your door on Monday morning. So have a patient photograph, video, and written testimonial consent and release form available for patients to sign. Hopefully you never have a patient file a complaint. Here's a complaint form. Just have HIPAA policies and procedures. You know what's very popular now? Most of the doctors we work with text patients information. Have a policy on texting patients, on emailing patients, on staff training, on emergency backup and recovery plans. Employee awareness. If you work with us and use our HIPAA cloud-based portal for training, you'll have all staff members watch videos, simple, quick videos, and then take a simple test. And then you get a little certification that you completed your HIPAA training. It'll help you SWAN. That's one of my favorite acronyms. SWAN means sleep well at night. Now back to, if you have the time, you don't have the money to hire someone, you have the time to create a HIPAA program on your own, this is the link right here, HIPAA for healthcare professionals. If you have the time to do your own security risk assessment, go to this. This is federal government websites. Here's my HIPAA SWAN checklist. Again, SWAN stands for Sleep Well at Night. Designate someone to be the compliance officer, create policies and procedures, start with that HIPAA security risk assessment, identify your business associates and get updated business associate agreements, conduct formal staff trainings and log those trainings in your HIPAA policy manual. Now, if you want to use target coding as your HIPAA company to get you up to date, this is what it includes: one-on-one training, cloud-based portal, security risk assessment, and employee training logs. Everything you need to have a HIPAA compliance program, we've taken care of. Our compliance program right now also includes a billing and coding compliance manual. Here's what I recommend you do. Contact Natasha. Many of you know Natasha. Natasha's been with me for over 15 years. She is Target Coding's Chief Operating Officer, also runs our HIPAA compliance department. She is the HIPAA compliance manager. Schedule a free HIPAA consult with her. You could scan that QR code right on your screen, or you can give us a call or send an email to natasha@targetcoding.com and schedule a free HIPAA consult. Do it by January 31st. You don't have to start the program or pay for the program by January 31st, all you need to do is schedule a consult with Natasha by January 31st, and we'll include our billing and coding compliance manual. That's a $1,200 program. Will include, as part of your HIPAA compliance manual, will include a billing and coding compliance manual. So schedule a call with Natasha by January 31st to take advantage of that offer. Just a few closing comments. You know, prevention is very important. Don't wait for the oil light to flash on your dashboard. When it comes to billing and coding compliance, have policies and procedures like on employee training, cash plans, discounts, deductibles, co-pays, co-insurance. If you waive a deductible on a patient because you want to be a nice guy, you're looking for trouble. An investigator doesn't look at it as being a nice guy. They look at it as a kickback. And what does that do? It violates the anti-kickback statute. Do background checks on your employee. You don't know how to do it? We'll show you how to do it. Have a policy on documentation. You're not sure how to have one? We'll show you. You want to prevent these letters, post-payment audits asking for money back. Now, we've helped a lot of doctors over the past few years. I'm great at negotiating down clawbacks from insurance companies. I've helped over 100 doctors negotiate settlements. We help doctors with their notes. Let me show you proof. This is a doctor we worked with. This doctor was billing Blue Cross Blue Shield of South Carolina. This doctor was requested to send in the notes. We helped this doctor with the notes and gets a letter back. A review of the records you provided determined that they meet the requirements outlined in our policy. Therefore, this audit is being closed with no further action. That's not good news, that's great news. Here's another one. Doctor, very busy practice, requested notes by an insurance company. We helped this doctor, gets this letter back. Third sentence, second paragraph, it says, we applaud you on your billing accuracy, and we encourage you to continue your current billing practices. Again, this is not a good letter. This is a great letter. So we do billing and coding compliance manuals. We do a lot of things you may not be aware. Some of you think Target Coding just does free webinars like this one. We do a lot more. We offer many different products and services. We offer HIPAA compliance manuals, billing and coding compliance manuals. Again, there's Natasha. Scan that QR code, set up a meeting with her. I wrote a book on the best codes to improve reimbursement. It's an excellent book. It should be part of every chiropractic billing and coding library. It has 3 chapters. Chapter 1 shows you the codes that pay for the most visits. Wouldn't that be a good thing to know? How many visits based on your diagnosis will you get paid? Sciatica, 18 to 24 visits, long-term treatment. Muscle spasm, M62.830, short-term treatment. You also get these cheat sheets emailed to you instantly as soon as you order the book, and it gives you the hierarchy, the codes that pay for the most visits to the codes that pay for the least amount of visits. In section 2, I show you how to pair your codes. What do I mean by that? Pairing CPT codes to diagnosis codes. What are CPT codes? CPT codes are what you're doing. Diagnosis codes are why you're doing what you're doing, and they should pair like food and wine, like peanut butter and chocolate. There's an example. CPT code 97140 pairs beautifully with M7912. So chapter 2 of the book shows you how to pair your codes, broken down by anatomic site. Section 3, I give you 25 of the most common chiropractic diagnosis codes and a little checklist, the subjective findings, the orthopedic findings, the neurological findings, and the chiropractic findings. I had a few experts in the field of clinical diagnosis help me with this section. You get FAQs, you get this spreadsheet that shows you how to prevent the excludes 1 diagnosis code bundling denials. So yes, we do seminars, we do webinars on many different topics. We have a library of on-demand webinars. Go to targetcoding.com, click on the on-demand tab. You'll see 25 courses. They're all up to date. Many of them you can get CEUs. You don't have to take a live webinar with us. On demand. You could watch our webinars at 2 o'clock in the morning and get CEUs for many of them. We have one coming up tomorrow. 6 CEUs, live webinars, 6 CEUs tomorrow, January 22nd from 8 a.m. to 2 p.m. Approved for 6 CEUs in over 30 states. We do these every other month. We have a 6 CEU extravaganza. So we do webinars that are 1 hour, 2 hours, and 6 hours. Just go to targetcoding.com, click on the webinars page, and you'll see all of our upcoming webinars. You'll see our webinars on our CA boot camps. We call it our CAT series, Chiropractic Assistant Training Series. 6 one-hour courses specifically for CAs to improve efficiency, reduce administrative burden, elevate your skills. Great for seasoned CAs, great for brand new CAs. CA class number 1, we go over chiropractic terminology, spinal anatomy, new patient onboarding. Class number 2, we go over how to fill out the 1500 form. The 1500 form has 33 boxes. We go over every single box in detail. We go over how to interpret EOBs. In class number 3, we go over Medicare and how to complete pre-authorization forms. And number 4, we go over showing CAs how to help the doctors with the SOAP notes. Class number 5, we go over ICD-10 coding, rehab coding, CPT coding, time-based coding. In class number 6, we go over HIPAA compliance and the 7 elements of an effective billing and coding compliance plan. We offer memberships. Level 1, $99 a month, pay as you go, and you get access to every single live webinar, unlimited question and answer support. We offer pay by hour coaching, personal coaching to address your specific situations. All the HIPAA forms we showed you today come from my package of 100 chiropractic forms, Medicare forms, HIPAA forms, fight back letters, administrative forms, financial forms, patient policy forms, financial hardship forms, consent to treat minor forms, ABN forms, all of our HIPAA forms, sample SOAP notes. All you need to do is click on the link on the website and all the forms will get emailed to you instantly in Microsoft Word. All you need to do is copy and paste them into your software programs. I mentioned our HIPAA program. We do chart reviews. We do credentialing. We do a lot of target coding. You may not be aware. Here, we offer 14 products and services, videos on neuropathy, decompression, laser, shockwave, chart reviews, Medicare, modifiers, cash plans. We have tons of testimonials. We have options to fit every practice. Please check with all the carriers your bill prior to submitting claims based on this information to ensure it's compliant. We can't guarantee this information will guarantee payment from any insurance company or patient. Target coding is not responsible for any laws or rules that may change following this webinar, and you know they change all the time. Stay up to date. Do your best to stay on top of these changes by attending seminars and webinars. Join your National and State Professional Association. Again, there's Natasha's QR code. Set up a time to speak to her. Here's my contact information. Email info@targetcoding.com. Follow us on Facebook, Instagram, LinkedIn, YouTube. I just uploaded a YouTube video. It's free on the 2026 coding updates. Check it out. Go to YouTube, put in the search area Target Coding, and you'll see my YouTube channel. Website targetcoding.com, telephone number 1-800-270-7044. Yes, we still have doctors that like to fax us information, so you know we have a HIPAA secure fax number. You don't have to white out or black out patient names. We have a HIPAA secure fax number. It's 1-844-831-2347. If you'd like to set up a free call with me, go over any questions you have. You could scan that QR code. It takes you right to my calendar, or you can give us a call or send us an email. So again, I want to thank everyone for attending. I hope you learned a lot. Take care, everyone. Bye-bye.